online, JJ.
Thanks, Benji. It's great to be here virtually. As you can tell, everything is fine, as the meme goes. We have a lot to talk about, and certainly a lot of struggles have been going on recently. So at some point, we want to make sure to pause and take some questions, because I know that many folks have pretty complicated questions to deal with. That has been not the most surprising aspect of the last month and a half, but certainly we found a lot of constituent cases are only compounded by whether it's not being able to leave the house, whether or criminal matters that that go well beyond where they should be going. So we've had a lot of interesting constituent cases, and that's certainly been keeping us busy. But then there's just the regular baseline policy piece that many of you, of course, have seen me talk about in a number of Facebook Lives, on the news, and of course, more folks have been tuning into the Commissioner's Court, having not been interested for good reason, because everyone has their own life and they can get everything done without the Commissioner's Court. We're kind of a baseline or background entity. Some of you have heard me before kind of delineate the difference between cities and counties. Your city, you come into contact a heck of a lot more in an urban environment. They're doing your water, your municipal policing, your major services. So you come into contact with them very often. The county in an urban environment recedes essentially. So if we were in a rural county, you would really know what your county commissioners do, because they're more on the front lines. Your sheriff's department would be your local policing. You'd have a mud district or some type of water district that the county would, have at least input in. They would have created that board and, have some involvement with it continuing. So if that rural county commissioner also is in charge of all the roads. So I have a road and bridge district. I have a whopping 6 miles of roads here in Dallas County, out a little bit further past Rowlett and Saxe. So it's a large part of what your rural county commissioners do. I have Aaron Cedar, who many of you all know, who handles every problem extraordinarily quickly, much to the delight of the good old boys that are out there. They love to see the young man, the yarmulke, come by and fix their problems, lickety split. It's kind of fun to see that interaction. I know he enjoys it a ton. He's great with the constituent services. So I wanted to kind of take everyone through this crisis, this pandemic, if you will, a little bit from my perspective, the timeline that we're exposed to it, and then kind of take moments to talk about how that is working legally, practically, kind of where the decision points were, just to kind of give you a better idea of what had been going on. So again, kind of go back to that city-county piece. County's in the forefronts right now because we're essentially an arm of the state. We are the emergency arm, right? So that's why Judge Jenkins has that power. That there's a disaster declaration in the city of Dallas, and the mayor there, and the mayors of Coppell, of Carrollton, all the other cities in District 2, they all have their own separate disaster declarations as well, and certain powers are bestowed upon the mayor in those instances. But really, the state efforts are largely coordinated through the counties and through the county judges. So when there's a disaster declaration, and this is certainly something that the legislature will probably be taking a look at, because there has been very reasonable and understandable complaints regarding the overreach of some of the county judges in a number of our in a number of our Texas counties. They are the arm of the state, and the first one that kind of reaches out. So when you're talking about the floods in Harris County, the county judge there, Ed Emmett at the time, very, very competent, and was the forefront there. Now you have Lydia Hidalgo, not nearly as competent, and she's made some major missteps in Harris County. And the nature of this disaster is different than your tornado, your hurricane, and sometimes the law. People will say bad facts make for bad law. Well, sometimes bad facts are bad. Anticipating certain things, you don't think about other types of disasters, if you will. So, our disaster declarations and our disaster law is really designed for those kind of hot fights, if you will. We got to get debris cleared away. We have to save lives. We have to get people food and shelter in the interim when we're talking about hurricanes, tornadoes. A disaster declaration and it is lawful to have a disaster declaration in this pandemic type scenario, but it's ill-fitting, particularly regarding the powers that your county judge has during that process. So we are going to need to press our state senators and our House reps to change that a bit, because I really do think pandemic disease is going to be more of a reality. I think we've heard a number of times on the news and other places that it's more surprising that this hasn't happened earlier, given the fact that we're a planet of so many more people, and our major diseases, kind of the store of human diseases and human misery, if you will, is from zoonotic transfer. So, measles, mumps, all the rest of those, they come from cows, and you have chickenpox from chicken. So, when you have people in contact with particularly birds, and then swine and the rest of it, those viruses that breed and are available at a much higher rate. Very few of them do come over into the human race. When some of them do, they are disastrous, as we're seeing, with this coronavirus. Influenza being typically what we're used to, and that starts in birds, usually goes to pigs, finds its way to us that way. So let's kind of go through some of the timeline that just where this all started. So on March 12th, we had our disaster declaration. And at that point, we were looking at not only China, but starting to see the breakdown in Europe, specifically. Really from early on, you can tell that things were not going so well in Italy and Spain. Spain a little bit later, but Italy certainly was one of the ones that came to the forefront. The next day, on the 13th, Governor Abbott declared a disaster in the state of Texas. On the 19th, so 1 week after the initial extension, the Commissioner's Court extended the declaration until just up to the governor's declaration. On the 21st is kind of when the first majorly controversial order came into place, and that was Judge Jenkins's shelter-in-place order. And still to this day, I'm supportive that we did that at that time. I think it's kind of important to talk about the nature of pandemics. There's been a tremendous amount of talk and comparison, and sometimes unfruitful comparison, to the Spanish flu influenza of 1918, 1919. One of the biggest highlights of that pandemic to look at first is the government failure. We were, the United States and the major Western powers were engaged in World War I. And the only reason why that thing got called Spanish influenza, Spanish flu, is they were the only press that would actually talk about it. The other, the Allied powers, so the United States, the UK, intentionally suppressed any discussion of the influenza problems in their media to make sure that they weren't causing morale problems within the populace. So what ended up happening is, when it finally did hit, and hit as hard as it did hit, it scared the hell out of people, and created tremendous damage, long-lasting economic damage, because people were still so whipsawed, if you will, by the misinformation. There were finally some Western states, Colorado, that were later hit, and the East Coast was hit earlier. They did receive proper media reports, if you will. And many of those, small towns and larger towns in Colorado, and they were a really great example. Their media, their local media, kind of pushed back against those censor boards, explained the nature of it. Their local officials would be posting people at train depots and on roadways to stop people from coming in. And they effectively quarantined themselves out of some of those trouble when it came to the Spanish influenza. So, the lesson learned there is having a good media is really helpful. We don't have that right now. So we have the opposite. We have media that is, certainly continuing upon the theory of it bleeds, and, I guess if it snots, it bleeds. I don't know. So that's I guess the closest thing you can say with the coronavirus. But, they certainly are pumping up the misery and, trying to get people as frightened as possible to keep tuning in. That's, they're in the business of selling advertising. And unfortunately, that's a major problem for communications in our nation and just kind of properly disseminating information, because we don't have a mainstream media we can trust. And then you have, your kind of social media pieces, and a lot becomes lost in the mix. You really don't know who to believe and what to think of a lot of it. So problematic from a lot of angles. So we go back to the 22nd, and the major issue that most folks have modeled out. I know a lot of folks want to keep going back to the Imperial College model. Most folks, including myself, I saw that once on the 22nd and on the 23rd, in open court, when we had an emergency meeting, asked Dr. Wong to present us with something much more meaningful. He shifted that data just to focus on Dallas County and took out a number of the kind of stuck with some of the major pieces of the model, but did not, he had a 60% infection rate, which is just totally insane. I mean, there's nothing that infects it that high. So he kind of made it a little bit more reasonable. So, early on, we stepped away from that model pretty quickly. I mean, less than 24 hours later. So I know that for a while there, for 2 or 3 weeks, there was, people pointing back to, you're using the Imperial College model, King's X, you're totally wrong. Everything you've done policy-wide is wrong from that standpoint forward. And it's like, no, folks, that was one model that was clearly a scare tactic, which I was, pretty upset about. But the most important models, if you will, were beds and ventilators. And beds and ventilators, most importantly, because beds are something, particularly with the support from the federal government, there are beds in other places and they're easy to get here. There wasn't a lot of ventilators. So some of the early discussions that I had with folks that were kind of pushing against the, hey, let's shelter in place, the question I would ask is, how many ventilators do you think we have? And every person said something to the nature of, oh, we probably have 10,000, we have this and that. We had, at the beginning of this, and we still now approximately have that much, about 659 ventilators. So if the Italy scenario were to come off here like it did there, and there's a whole host of reasons why it didn't and perhaps why it couldn't, but from a policy perspective, I don't think it's prudent just to ignore it and say, oh, never going to happen here. If we had a similar growth in cases like Italy had, we would have run out of those ventilators in 2 weeks. And that was serious enough for me to say, okay, I'm going to support Judge Jenkins in this. The shelter in place is the right thing to do at this time. We got to be in a place of risk mitigation and be humble with our data. You don't want to gamble with lives or economics. And I think that was another thing that got lost, that a lot of the sales pitch that went on, particularly with Judge Jenkins, follow the science and it's all about saving me, Ma. Well, okay, that there's truth in that, and of course you want to do that. That is a moral thing and a moral goal. But there was not just mercantilists and other Austrian-leaning economic folks that were clearly making the statement that the healthcare crash is one thing that you certainly want to stave off, but even getting close to the healthcare crash and having enough sick and disabled and dying individuals within a population would be such a drag on GDP and the ability for the country to rebound, that you would do just as much damage by not doing anything than you would with what was a move that created a lot of economic devastation. Absolutely, when that shelter in place took hold, and then certainly took hold Texas wide. We were at the early part of it, just the earliest metrics. 2 weeks into it, we had already lost $35 million in revenue from what we do. And you start to extrapolate that out, it only gets worse week over week as things get further and further along. Then you start listening to industry experts and the Fed and seeing the GDP hit, and you start to realize in the first 2 weeks you're looking at over $1 billion in loss. That also starts to compound and get worse and worse the longer the thing goes on. So clearly the economic piece was thought about. It was considered, and as we kind of get back later to, now we're starting to realize that those considerations are now more important in many respects. So the unknowns still linger a great deal regarding coronavirus. So some folks have got a good primer on what a coronavirus is. Rhinovirus, coronavirus, and influenza. They've been around forever. Coronaviruses typically are mild unless it's SARS or MERS. We've seen those two instances of those upper respiratory diseases that are a huge killer in many respects. This, we're starting to find out is not as deadly, is not as lethal. It still is terrible. I mean, I'm sure many of you have had, friends and relatives now that have been exposed to it and have gone through, the long period of illness. It incubates over a fairly long period of time. You can start to feel symptoms as soon as 3 days, but it can be as long as 14 days out, which is tremendously difficult for policy folks. At least with the Spanish influenza, if people were being honest and really saw it, you knew what your symptoms were, you knew how quickly it was moving, and you had a better gauge of things within 2 weeks of information. With the coronavirus, because of the slowness of the spread and how it develops, so slowly in individuals, there's still a lot of things that are unknown about it. One of the most surprising things that we're just starting to, filter out, 47% of the cases in New York City, and the number is holding in a lot of places, did not have a fever when they started to present other symptoms and were at a critical having to be admitted to the hospital situation. 35% didn't have any dry cough. So there's a number of the major hallmark symptoms that we're using to filter people essentially, to make sure that go home if you have a fever, go home if you have a dry cough. Well, there's people that have coronavirus that are shedding virus that don't show either of those two symptoms. Now, granted, that would have to be an overlap of 47%, 37%. For those of you who are good at statistics, it's probably somewhere in the range of 5 to 7% of those folks would pop up like that. So not a major possibility, but still, you get a lot of folks that are going to have two of the major symptoms not presenting, and they're going to be shedding virus. So which is really a problem for all of us that are trying to make some decisions. So we're also starting to see a lot of diarrhea in kids. This disease, like influenza, is an RNA virus. So it's called a swarm virus, essentially. So it can mutate quickly, and because RNA doesn't duplicate perfectly, if you will. It can mutate rapidly. It can change to adapt into its environment very well. One of the positive things about that, though, is that the most successful viruses are mild, because if it really kicks your butt, you typically take yourself out of populations. Now, it is fairly successful because people would shed a virus without having symptoms. But for the most part, there is the hope that as it does mutate, the more successful strains will be those that are actually less deadly, less aggressive. So, positive thing in that regard. So back to our shelter in place. There we are in shelter in place, and we had a great deal of data just from looking at the places that had this thing before us. And the best one to look at, and still the one that I think many of us are still looking at, is King County, Seattle, and Washington. They had some of the earliest cases. They had a tremendous amount of quick spread in a number of nursing homes, and they had a lot of quick deaths. But the overall population that was infected was actually pretty small. Why they're a great comparison? I mean, they have similar densities to us. King County is like 2.1 million with a number of counties adjacent that are similar to like a Denton County, a Collin County. People work in Seattle, people work in Redmond and travel back and forth to places that are a lot like Frisco. They actually have a great degree less poverty than we do, and they also have a healthier population. So, while they have comparatively, good density, good numbers to look at and see where they're going and see what they've done and try to, follow the leader, if you will. They also have kind of a better perch, if you will, because the one thing that has popped out and become clear, those with diabetes, those with the underlying conditions are, a tremendous risk. And we have a lot more of those folks, particularly those that are in poverty. And as it works out, those that are in poverty tend to be in closer proximity to other folks and working jobs where, they could more likely to be exposed. So that's kind of one of our greater downsides, but in following their shutdown and how they sheltered in place and watching them as they go forward has given us, good pockets of information and lets us know that, right now, and certainly I know that plenty of folks are, some are happy, some are delighted with what the governor has done, but there are plenty that are just, it doesn't go far enough and this is totally nuts, we should still be shut down. I'm in the camp of, I'm happy the way that the governor is approaching this. If we take good measured steps, we'll accomplish a couple things, and I'll kind of get to those right now, I guess. Because here we are at kind of the greater correction. All right, so we avoided, and priority number one was to avoid the medical crash. Okay, and that was critical. If you screw that up, nothing else matters because your economy's toast and you have a bunch of dead people. Quite simply. So we got that right. We have plenty of bandwidth, and now we're ready to go forward on finding ways to get people back to work in a safe manner. Getting people back to work in a safe manner isn't cheap. The governor, with his 25% rule, throws a bone to folks that want to open stuff up. And day one, I was very excited about it. Hey, we're going to get really get back going. And then I started to talk to business owners, and including someone who owns 8 restaurants. And he was very candid. He said, listen, even before I knew what the governor was going to lay out for us, I had a rough estimate. This was going to cost me $300,000 per location to ramp up and open back up. 25% occupancy isn't going to do it for me. I'm barely making it with the takeout orders. This is going to be a deadweight loss. Not going to open any of those locations until we're at least looking at 50%. And even then, those numbers still look like a break-even point. If I don't have the employees, and many folks don't have the employees because frankly, because of the incentives that were placed in the unemployment bonuses, it's better for them to be laid off. A lot of these restaurants are facing that dilemma. So their better employees are getting paid better by sitting at home. It's going to be difficult to get good people back. You want your good people back that know, kind of the general framework of how your restaurant works, because on top of that, they're going to have to be super vigilant and to do the right things to keep things clean. So unfortunately, it's really not going to be the economic shot in the arm that some of us had hoped for. I think it is a positive thing to help with the unrest that's going on. And that was one piece going back to the commissioner's court here on April 21st that I was kind of most concerned about. We were making a decision at that court to extend our shelter in place out until May 15th, which was ridiculous. I mean, the good decision making requires, is this a decision that I have to make right now? Is it, I'm seeing the whites of the eyes, if you will, the problem breathing down my neck. We weren't. We had another week to take in some more information, get some more data, and see really where we were to figure out the contours of what we wanted to do here in Dallas County. Because, and I really do believe this, because of the judge's, complete intransigence when it comes to dealing with the governor, I think, that was probably one of the, I know that, the governor had his strike force team already preparing an opening, but I'm certain that all right, everyone's following it like this. There's no exceptions like there were before. I mean, the governor did allow both Tarrant and Dallas County to not have in-person worship, although in the clear language of his order, he had said that. But 2 days later, governor makes a very strong statement. 2 days later, we get an opinion from the AG's office. No, because you have a wide spread according to the CDC, you're allowed to do something different, which unfortunately, was disappointing. If you're going to lay it down and say, hey, everyone has to follow it, then stick through with that. And that was this time the governor's doing that. And I think he did that largely because we pushed him, or not we, I mean, Judge Jenkins and the other two pushed him by, saying, hey, we're extending out to the 15th and we're going to do it our way. So the governor did have to put his foot down. So regarding the long-term getting this thing right, it's positive that they kind of thumbed their nose at the governor and he finally had to push back like that. And same thing with Lydia had all go down to Harris County. I mean, she's, her mask thing. And again, we had that same problem here where the judge wanted to fine people or put them in jail. So you want to save people from COVID-19. And if they're not going to save themselves, then you're going to put them in the jail where 173 people have COVID-19. I mean, just, a little bit of the crazy paternalism that we find from the left often. They know much better how to live your life than you do. And they certainly know how better to spend your money. And they're delighted to do it whenever they have the opportunity, which comes to some of our problems coming up here. So easing that bottled up tension is a critical part of governor's plan. I don't see it as a realistic shot in the arm to the economy on this first step. Hopefully, and this is really where I'm hopeful, Dallas County, we had 170 some odd cases today. That's kind of a window 3 days into the past. So that's really when those cases were tested. The majority of them were tested. I'm very hopeful that over the next 3 and 4 days, we're going to start to see under 100 more reliably. That will come back up though, as we kind of get more folks bopping around. That's not a problem until we start seeing 500 cases a day. When we start seeing 500 cases a day, it's been pretty stable that about 200 of them will require some hospitalization at some point. And that's when things get a little tricky. That's when we start to run out of hospital beds. But, we're in a place where we do have a lot of room in those hospitals. And I'm not advocating, use it up to the fullest so you can put the throttle as much as you can in the economy. I think that's a little foolish, but we can afford some more cases because we've seasoned our first responders. And I know that sounds a little too scientific and not, not a friendly thing, but the vast majority of our first responders and healthcare workers have been exposed, and many of them have gotten sick. Some of them have died, all right, particularly in New York, New Jersey. But when we're talking about Texas, we've had a lot of first responders get seasoned. And fortunately, thank God, we found out from South Korea that they initially were reporting that perhaps you don't have a lasting immunity because there was essentially false negatives in the middle of a testing cycle. So we had a bunch of individuals, they're positive, false negative testing, then they tested positive again. They went back through all those cases and uniformly they were false negatives in the middle. So thank goodness that's the case because we're going to need herd immunity to move forward. I mean, I think it's wonderful that we have the Revestivir drug that'll help reduce the number of those serious cases and get people out of the hospital quicker. And it also gets us down a path where we're going to be able to deal with a lot of the cases more quickly. But the bottom line is that we're going to have a seasoned population by the time we get to July and August. And the most critical seasoned population are the first responders, because when the waves do come, you can't have a bunch of nurses and doctors dying or getting sick. They need to be there. So, spreading this out not only helped the healthcare crash, but also helped make sure that we had, our seasoned populations that need to be in place when the rest of us suckers have to go out there and essentially face it. Now, for our most vulnerable populations, we certainly gotta keep them safe. And that's not a cheap enterprise, though. And that's been something that gets repeated over and over again. We have, we'll be, some people kind of, oh, it's just so easy. We're going to be able to keep them safe. Not a problem. It's really tough because there's so many logistical aspects of, getting food and everything we need to those folks without infecting them en masse. I mean, one person in one of those homes gets sick and it goes like wildfire. So, there is a great deal of expense in getting that part right. Slowing the spread so that we can kind of season people in a reasonable manner will require making sure that we don't have those large events for quite some time until we're confident that we have close to herd immunity. And that absolutely can mean no college football. I know that is first and foremost along a lot of people's minds. Talked about the bottling up. Some people want to talk about Shelley Luther. I feel sorry for her. I mean, she's a victim of the circumstances. There's no way she should be arrested and put in jail. That's just, that is not punishment fitting the crime, if you will. This needs to be handled in a civil matter, literally, not just politely. The civil court and her the orders and her motion to compel. She needs to be fined. There is a rule of law. The laws are there. You may believe the law to be unconstitutional, but it hasn't been deemed so just yet. And I'm a lawyer and I believe in the rule of law. And listen, there's plenty of people that want to argue that pot should be legal, right? It's legal in Colorado. It's legal there. Well, and listen, we have a rule of law. We've decided as a democracy here in Texas that that's just not going to be the case. All right. So this is how we're managing. Your elected officials are managing this particular situation until there is something that is a direct infringement upon rights and it gets sorted out in the court. Then there's kind of the will for defiance. I think is probably one of the biggest problems. Now, I good and well know plenty of people have called me and say I'm opening my office, I'm doing that, and I just pretend, well, I didn't hear you. The willful defiance problem, and it's something that you're necessarily going to see because people are starving, people are in major dire straits. It's understandable, but at the end of the day, we still have a rule of law. And we got to follow that, right? So I'm certainly going to push back if there's any attempt to put her in jail, because that's BS. There's no way we can do that. But it's going to be critical that we kind of get on board, ease the tension, start allowing people to go back to work, manage the healthcare system, and because we are clearly at a point now where we cannot afford any more of the shelter in place, and that's the bottom line. There was a point where people were talking about the cure being worse than disease. We hadn't gotten there yet. We are there now. We're absolutely there where the cure is worse than the disease. We should be and are, for the most part, ready with the major components. We don't have enough testing. That's still a major hole. We still have major holes regarding PPE, but it's getting better. We've given ourselves enough time and enough lead time in manufacturing to get those things. So, if any of your elected officials say, well, we don't have X, Y, and Z, the biggest pushback is you had 4 weeks. You had more than 4 weeks to get this stuff done. So, we are at a time where it is now time to, start pushing forward slowly, carefully to make sure we don't cause any more of those huge spikes that we've seen in other places. I don't think we're going to with the governor's plan. I think it is a good plan in that regard. I think stage 2 is where things get actually most hairy though. So this first stage, 25%, tons of places aren't opening up. They just aren't. At 50%, you're going to start to see more places open up, and that's probably where you start to get those larger spikes, and we get a little bit closer to places where we're peaked. But again, we've seasoned our first responders. We should, in that 2 week, we still have another 2 weeks to get our PPE. At least for Dallas County, we'll have enough. I know Parkland will have enough out to June by the end of the week. So we have the supplies we need. But again, going back to the keeping people safe and it not being cheap. I mean, what we're asking of a lot of these companies is, A lot of sanitation, a lot of keeping things clean. For our part in Dallas County, we can't get a hold of Lysol wipes. We can't get a hold of a lot of basic cleaning materials. And we buy in the biggest of bulk from the biggest of brands and from the biggest of Fortune 500 companies, whether it's Grainger or the rest of them. So the idea that some of these mom and pop shops are going to be able to get all the supplies that they need is a little bit laughable. So there is going to be some, major bottlenecks still within manufacturing, and of course, you're hearing more about the meat bottlenecks and those other pieces, which are pretty serious. But getting back to business and starting back up again necessarily will be pretty expensive, and it's going to be incumbent upon the federal government and our local governments to provide tax breaks to those businesses that are getting back in the game and hiring people and getting the economy back moving, to make sure that they know the light at the end of the tunnel is that they're going to have to lay out significant amounts of capital, but they're going to be able to recoup that in breaks later down the road. So where are we now? Well, we've had a number of kind of target fixations, if you will. For a while there, we were targeted, the target fixation was avoiding the healthcare crash. We've moved from that crisis. Unfortunately, there's a contingent, and certainly Judge Jenkins falls in that, and to the extent that Dr. Wong feels as though that he's his boss, he's getting pulled in that direction, that it's now priority drift is, save all lives. And, as everyone knows, that's just not possible. We're in a situation now where we're trading lives. We can quote unquote, save the lives from the disease, or we can save lives from the terrible things that are going on, whether it's domestic violence. We had a case with a 13-year-old girl that got raped because she was in a house she should have never been in because she was sheltered in there. We have some pretty terrible stuff that my office has been having to deal with. And, clearly, these are real trade-offs that, we've got to now start to address more quickly. So I think it's kind of most of what I had prepared. Let's get some questions.
Yeah, no, thank you so much, JJ. That was great. I appreciate it. Yeah, we got a ton of questions here. And one of the great things I love about our group is we have so many diverse opinions. So we're going to get all over the map here, I think.
Sure.
So first question is from Joel Schwitzer. Hopefully I'm pronouncing that correctly. Considering we just had a single day high with 179 new cases, do you think that this is the time to reopen even at the limited and measured levels laid out by the governor's strike force, in your opinion?
Yeah, we have enough hospital resources to handle somewhere around 60 days like this, okay? Because, if we have 170 some odd cases, about 30% of those or less need hospitalization. So, with 2,000, at least safely 2,000 bed spaces in Dallas County, we can handle this. It will be problematic, though, if those are, our most vulnerable populations. So the one thing that can never, we have to keep our eye on that ball, is that the nursing homes and our most vulnerable folks need to be protected. Because if they're amongst those 170, so we're in trouble. If those are more or younger folks, since we are seeing more of the medicines that are coming online that are helping out, we understand the virus better. We're not jumping to put people on ventilators, because in many respects that's actually killing people. Since we know more about the virus now, we can actually treat it. The way that many folks are being treated when they enter in the hospital from 4 weeks ago is dramatically different. Okay, so we are seeing better results because of that, and we're continuing to learn more. So I can safely say that, we are in a situation where we are trading lives. There's going to be some loss of life by going forward like this. I think we're getting to a point, though, where it's extraordinarily manageable. And, we're zeroing out. We're actually moving in a direction where we're going to be saving more lives than we are losing lives.
Right. Gotcha. Another question from Asher Bublik. Why specifically could we not adopt the Swedish model? Surely they don't have a stockpile of ventilators, he says.
Yeah. What's been going on in Sweden is absolutely interesting, and it does present a stark contrast to where what we've decided and where we're going. The first couple highlights, though, are how different our population is from Sweden. We are far less healthy. We are far larger and far more diverse in our unhealthfulness. So, our case rates of diabetes, and all the things that we know, like not we speculate on. We now know, we've seen enough of these cases. We have a lot of diabetes, a lot of obesity, plenty of asthma, all the things that complicate these things really significantly. Very different than Sweden. I mean, they have a much healthier population. They live a very different lifestyle. And there's good signaling that they were able to get away with it essentially. I absolutely adore being an American, but there's certain things that we got to look in a mirror and say, hey, listen, we're bad at this. We're bad at maintaining our own health. We just are. There's a reason why we spend so much on healthcare. It's because we're generally unhealthy. We work ourselves to death, and we don't treat our bodies as the temple as we're kind of told to. I do a bad job of it too. They don't. I mean, they do a much better job. They have much leaner socialized medicine, so people know they have to take it into their own hands. I'm certainly not advocating for socialized medicine, but I'm certainly advocating for folks being able to take more of their health measures into their own hands. That's one lesson that hopefully we'll learn from this pandemic going forward. Well, hey, listen, if we can trust people and encourage them more to do a better job of taking care of their own health, and perhaps moving away from certain types of insurance that incentivize unhealthfulness, but rather, hey, listen, high deductibles, $5,000s of dollars of this is going to come out of your pocket. That's going to go a long way in people saying, you know what, maybe I should drop that 20 pounds. Maybe I should do a better job managing my diabetes. Those are some things that, you want to kind of create the behaviors that make us who we always think we are and who we should be, individuals that can take care of our own damn selves. So I think that's the biggest difference, that the health profile is such that, we would necessarily have a much different and much steeper curve than they would have, and it would be far more costly than what they're seeing. They are seeing more cases, they are seeing more deaths. It's helpful. There's a certain segment of our population though that we should allow to be Sweden. We're getting there. We're getting to the point where our young and healthy folks need to get back out, need to get seasoned. We can, help them in very manageable ways. They're not going to be flooding the hospitals. They're going to need to, come into a doc in the box and go back home and take care of the thing. And then they're going to have immunity for it, right? So we are eventually going to get to a place where there is a large portion of our population, everywhere from 20 to about, 55, that we are going to treat like Sweden. And we're getting there. And hopefully we'll be there fully by the time we get to June.
Makes sense. Another question from Joel Shacker. He asks, there's been televised inferred friction between Clay Jenkins and Governor Abbott. Can you shed any light on that story?
Yeah. Unfortunately, that's something that, it's like, I don't know, the children of divorce, but, I've gotten stuck in the middle of that. So I get, I talked to Louis Sines. He's the governor's chief of staff. And particularly when we were dealing with the KBH situation. So, when that kind of blew up on Sunday, that was a point where we're still thinking maybe we need those extra hospital beds. And Clay was really playing fast and loose with his communication. And honestly, he was not treating, the federal folks with the respect they were due. And one thing that anyone who's, been in the military or been around military people know, communication is simple. And you're taking, at your word, because, they don't, get into convoluted speeches, do a thing, do it now type of deal. And, the way that, and his exact words were, we may not need it. We probably won't need it. He's kind of hemming and hawing like that, thinking out loud, if you will, in a time that was entirely inappropriate. So he scared the hell out of, the Army head, the Navy head, so the Army National Guard was, handling the logistics and supplies. Navy was handling the doctors and the medical staff. They heard the same thing and they relayed that to Nim Kidd. Nim Kidd loses his mind and talks to the governor and says, what the hell's going on? We're about to lose this asset because Clay, can't talk straight, essentially. Everything else that Judge Jenkins had done, funding it all looked as though, he wanted this thing, but it was just kind of one or two statements that made them think that wasn't the case. And so you have that breakdown in communication and the fact that the only time up until that point that Judge Jenkins had directed any communication to the governor was through Twitter. And the whole time he was shitty about the fact that we haven't had Medicare expansion. I mean, he took every opportunity to hammer the governor about, we don't have Medicare expansion. You're a terrible human being. You're awful. You hate people. And, that's not a good way to develop a good working relationship in the time of a crisis. So, plenty of people want to get upset with me that, my attacks on Clay have been political. Well, one, it has to do with straight up corruption. But two, he started it. Pretty childish. I mean, he absolutely was just taking pot shots at the governor during a difficult time, and making sure that those lines of communication would be poor. If any of you are, fans of or history buffs, it's a lot like McClellan and Lincoln in the Civil War. I mean, little Mac was such a pain in the ass and did everything that he wanted to do, didn't follow orders, couldn't get the thing done. And fortunately, Lincoln was able to relieve him of command. Now, unfortunately, it's going to be much harder to relieve Judge Jenkins of command, but hopefully it'll be something that will happen in the near future.
Got it. That was great. Chelsea Williams asks, what advice do you have for citizens who suffer from non-visible disabilities that are exempt from wearing face masks that some businesses wish to enforce while shopping? And is there any guidance being given to businesses about their desire to require a face mask but still be in compliance with ADA?
Yeah, that's going to be a tough one. There's tons of case law regarding, it's your business, you can do what you want. Well, that stopped when the federal government stepped in to say, well, you can't, kick someone out on the basis of race. And later you get the ADA and you can't, exclude someone from your business because you don't have a handicap ramp or you don't have, these ADA compliant pieces. So, there's certainly going to be an inherent tension in that. But I will say that the federal government has been very clear on their desire to have everyone wearing face masks. And I know for some people that's a huge problem. I wanted to make sure that we're not going to fine people and not going to put them in jail because they don't wear a face mask. But as a personal choice and as a personally responsible choice, I think it's a good idea to do that. I mean, I know for myself personally, I have to go down to commissioner's court. I have to go down to a lot of places. I'm easily putting myself in places where I'm going to expose myself to this thing. I don't have underlying conditions where this thing could get bad for me. So I'm thinking I'm probably pretty likely to be able to spread this to people. So here you go. I mean, here's my mask that I came up here with. Here I am, and I this was not a prop for this deal. I just
check out mine, JJ.
Let's see. That's awesome.
Highly recommend the Jewish Star face mask.
So I got mine early on and it was just plain Jane, but now you're seeing some of these great ones, including, old WWF, WWE star type things, which I'm really going to be interested in looking into. But I think it's important to do that if you can. If you have a condition where you cannot, see what you can figure out, see if you can get someone else to do the shopping for you. And we're going to have to work that out. But, there's going to be a small segment of the population that will have that problem. We're going to have to figure it out. I will say this, some of the objections that I hear are just, they're not there. It traps CO2. It doesn't. That's not how oxygen and CO2 work. You don't trap CO2, you get oxygen. If it was a full seal, then you would, certainly still get CO2. But the thing is, this is not 100% effective on getting the virus through, about stopping the virus. Newsflash, CO2 molecules are smaller than a virus. So if the virus can still get through, what else can still get through? That's right, oxygen and CO2. So, it really is more about you protecting other people because you may have it, not know you have it yet. And it's a lot like herd immunity. So, yes, you're not doing it for you. You're doing it for other people. And sometimes people don't expect that of Americans, but we know better. We know better when there's a time of crisis. Americans do for others and put others before themselves for little things like that. So I'm very confident here in the months to come. We're going to see people wearing masks. We're going to get this done. We're going to help our vulnerable populations, and we're going to get back to work.
Yeah, no, I hear what you're saying. Absolutely. Another question from some Steve Mang. He asks, with this virus and the orders that Clay Jenkins has put into place, how will this affect the Dallas County's operations for this November's election? I'm sure a lot of people are going to be curious about that.
Yeah, so the Democrats are going full court press on mail-in ballots, which we as Republicans know would be disastrous. There'd be, that is the heart of, the identified fraud in elections that we've seen. People want to talk about, someone's trying to vote in person. In-person voter fraud type stuff is highly, highly irregular. It never happens. It never happens. I mean, there's a lady who's an immigrant who did, either didn't know or should have known, and she tries to vote. But I mean, those are few and far between. Where it really happens, you have to ask Aaron Harris about this. Now he's with Congressman Lance Gooden's office. It's really in the mail-in ballot piece. Now, could they do it, to major effect here in the fall for federal or statewide races? Oh no, hell no. I mean, that's a lot of votes you got to screw up. And they've been, when people want to commit this type of fraud, it's those races that are 500, 1,000 people. But those races are more and more frequent, if you will. All right. So there's going to be a lot of state, there's going to be a lot of ISD races that are pushed in November. There's going to be local municipalities that are pushed in November, and the voter fraud in those down ballot races is highly likely. So, someone who, they can change, all I need to do is pick up 20 or 30 ballots, put them for my guy way down the ballot. And then, now I've stolen the election. They have the techniques, they just recently were doing it in Tarrant, Dallas County. Those tricks of the trade don't fall apart. It's not like someone, forgets how to steal cars. Those folks are still out there and going to do that. So it's a huge, huge problem. The Attorney General needs to present the best lines of defense. I mean, this is, we had a number of the Obamacare cases, and I really appreciate Ken Paxton on a lot of those. But fortunately, there was a lot of other states in that milieu that can kind of, carry the banner. So, we didn't have to be, the best and the brightest on that piece. We cannot screw this up. If we lose these challenges and mail-in balloting is forwarded, created here by mandate by the judges. One, it'll be outrageously expensive. We already have gone over the costs in Dallas County. We just spent $41 million on new building, new machines, new all this stuff. And I thought you can go back to I voted against every piece of it because, hey, we're moving too fast. And, how could I have known that this would have happened? But, we're really just totally about to piss away $41 million. Spend another $12 million to have a proper mail operation because it will cost that much in people, material, just regarding setup to get this done properly. So it could be a huge disaster, enormously expensive. So, keep Ken Paxton and his people in your thoughts and prayers. And, hopefully they're eating their Wheaties and their tuna and studying up as best they can because they got to win those arguments at every level convincingly, or else we're in huge trouble.
Yeah, makes sense. Lane Sullivan asks, what science and data is Dr. Philip Huang using? CDC only? My point is he reviewing the research, data, and science of Dr. David Katz at Yale and Dr. John Ioannidis at Stanford, both of whom have published articles refuting Dr. Fauci and Birx's data?
Yeah. So, there's a ton of models, and that's the one fallacy that I've been trying to get out to people. So Imperial College and some of the other population models are one piece of what has been looked at by Dr. Wong. The biggest piece is kind of the working backwards. So there's Javion. Gosh, what are some of these? And oh hell no. And I've got some of them right in front of me. So you got Penn Medicine's Chime. You've got Health Catalyst capacity planning tools, Cleveland Clinic's hospital impact modeling, University of Washington IHMA COVID-19 forecasting tool. So a lot of those tools, basically, it's been mostly working back from the resources we have and kind of, where are the points where this gets really bad? And the numbers that we keep coming upon, we start getting those 500 cases a day. We've had very, very stable hospitalization rates. It's been around that 30%. So we get X cases, we get 30%. Now, that'll drop necessarily as we get more testing, right? Because we're testing people that are asymptomatic now. So that may drop, but it'll probably only drop, down to maybe 20%. So if we're looking at that, 500 cases a day, and we're having to, the flow through is, we're getting 150, 100 that going into the hospital, that starts to pile up quickly. And that eats up those 2,000 beds. at a rate that's troubling, but not a problem. We start getting over 500. And if any of that gets skewed toward vulnerable populations, that's the real trouble. So when you're trying to figure out what is Dr. Wong looking at, he's really working backwards. And that's what everyone's doing right now. What are the resources we have? And what are the worst case scenarios with all the models that are showing me, okay, it's going to be 40,000 people. It's going to be 20,000 people. But like when it comes to, those general population models, we are using, or at least from what I see from him, very little of them now because we have 6 weeks of data. And we have 6 weeks of data that is robust enough to say, okay, when we have X number of cases, we have 30% going to the hospital, we have X number of going into the vet. So there's really no need for those, large, when Birx and Fauci, when they're looking at those models, they're planning for, the ventilators that need to move around, which they probably shouldn't be using as much, but also, the medicine, they're also moving around different regions. We're running the pop-up hospitals, Army resources. So they generally need to look at the larger, the entirety of a state, the entirety of the United States, because you kind of, the law of averages, the law of large numbers, those things should be getting a little bit better. Some of them aren't. I mean, some of them are still really poor regarding their predictive abilities because there are so many different things going on regionally. So that being said, our regional analysis is actually a lot tighter. So you don't have to worry about him going off the rails with bad data. We're using the data that we have that we've received now for 6 weeks, and it's reasonably predictive. And that's why you're not hearing, you heard Clay Jenkins come out after the governor's orders. Everyone stay safe. Clearly he was saying he doesn't like this, but there wasn't screaming, yelling, fire, like what's behind me, because there isn't. I mean, they reasonably know now that we know the thresholds, and really, the time to get worried is if you see 500 cases a day. Then it's time to get worried. Then we're moving in a direction where we're going to have a problem potentially with another healthcare crash. If we stay in the 200s and 300s, there will be significant loss of life, but we can manage it. We can absolutely manage it. So that's what I've gotten from Dr. Wong. I talked to him 2 days ago, and he's sending me a couple of those new kind of fall points, if you will.
Got it. Awesome. We got another question. Are you aware of any other time in history of where they quarantined healthy people and sick people simultaneously?
Yeah. So during the pandemic of 1918 and 1919, there were situations where that did happen. And everyone talks about the difference between the St. Louis and the Philadelphia response. The Philadelphia response was piss poor, and St. Louis did a much better job. There's also a ton of localities that so many of I read I read over 36 books a year, and I just recently finished The Great Pandemic the Great Influenza, because that's very timely right now. So I got a chance to go to some of the referenced what is referenced in the book, and learned a little bit more about some of those localities. So that's why I kind of studied a little bit up on what were some of the responses in the western states: Colorado, Utah, even here in Texas. El Paso had a major outbreak, and major difficulties, but other places in Texas did a good job of locking everyone up in the entirety of the town and not letting anyone in. Now, that works a lot better when you're dealing with influenza. That is fast. I mean, it presents in sometimes less than 24 hours. With this coronavirus, I mean, you can have an exposure and then not have any symptoms for 14 days. So necessarily had this longer lockdown at the beginning. We now have a much better idea of how it's working and just how dangerous it is to the entirety of the population. And there's a very good argument that a broad swath of this population will be fine when exposed to it. Now, when I say we'll be fine, there's going to be plenty of people that have major illness, that are 20, that are going to be laid up in a very serious way, perhaps even hospitalized, but they'll live. That's under normal circumstances, someone in a government official position is not like, I want to allow that to happen. but we're in certainly dire economic circumstances, and the trade-off is we're going to have to allow some of that to make this work. So yes, there are historical examples of kind of locking things down. It was for a much briefer time during that pandemic. And so this is a little bit unprecedented in the length of time that we've had this shelter in place.
Good to know. Did not know that. Why were small retail shops, this is from Robert Schlein, why were small retail shops targeted for closing? Why is shopping at Walmart safer than a specialty shop? And also to that point, other question, which is why is a salon, in your opinion, not as safe, or a gym not as safe as some of these other stores they allowed to open already?
Right. So in government, we all hate big and tall stores. No, I'm just kidding, Rob. No, you're 100% right. And there's a great argument made by Tucker Carlson that one of the mistakes that we made was we essentially pushed one individual in every household to these big box stores to potentially be exposed and then bring it back to their households. You can see that even though they're trying to do as much spacing as they can at Walmart and Target, it's not working so hot, and there are plenty of people getting exposed and causing problems. Now, it hasn't been like wildfire, kind of the Tucker Carlson argument. So there is a tremendous argument that some of the small businesses, particularly clothiers, if they were allowed to allow 5 or 6 people in, that wouldn't have been a problem. It would have been the same situation that you have when people need to get their clothing at Walmart or Target, but they're going to be spread out an even greater amount because they're not at Walmart or Target. And that was the same argument that I was using regarding Hobby Lobby and Michaels and the rest of them regarding masks, that why am I going to force everyone that needs their masking material? Yes, you're telling me you can get mask material at Target, Walmart, but I already have people there that need to get food there. I mean, that's kind of the baseline deal, and that's really why we want those places open. Let's put these other places open and make sure that they're responsible, but at least we'll kind of spread people out over those stores. So yes, initially locking everyone down and locking everything down, and then having just these retailers where everyone's being very, very careful, made sense at that time. We're now at a place where we do need to start spreading people out a great deal more by opening up more small businesses, including big and tall stores, because I'm very certain that there are a number of large men out there that need to get some of their clothes. So yes, your store should be open, and it can be open here tomorrow. And I'm hopeful that you'll be open, and hopefully you'll be able to get some registers ringing, because I know that it's been very painful for you and for a whole lot of folks. So and it's nothing that any of us ever wanted to see.
Yeah, absolutely. Joel asks, as shelter-in-place restrictions are loosened and we enter uncertain territory of whether the virus is under control versus the floodgates of activity opening, what is the level of concern about regional uniformity in loosening restrictions that could cause a pandemic recurrence?
Yeah. So, Judge Jenkins is encouraging people to use the baseline of shelter in place. The governor's order makes it clear that that's no longer the baseline. It's kind of back to where we were before shelter in place from the statewide perspective, where the major events, the major spreading events, if you will. So we're not going to have concerts. We're not going to have places filled with tons of people. We're not going to have bars. We're not going to have those places where you have the highest transmission. And to kind of go back to Rob's question, gyms, bars, people in close contact, when you're shedding virus in those environments, I mean, it's tinderbox. And those numbers, that science has actually been borne out really, really well. How far the virus spreads, how long it lasts in aerosol form in close contained environments. So gyms are really bad in that regard. People breathing heavily, aerosoling a ton of virus, and they may not know they have it. From kind of of the things that I've received from the doctors, I am least skeptical of that, because the testing that they've done on that recently has been very substantial. So I mean, there's been hospital testing. They test the aerosol levels outside of rooms where people have COVID-19, and they are finding it is making its way outside of rooms that have sheeting and shut doors. That means that this thing is pretty good at spreading and suspending itself in the air. So we've got to be really vigilant about that. Know that that's how the thing works. That's not fake news. That piece of it is true. Now, on the other side of that, if you do get it, it's not it's not a death sentence as though everyone was kind of saying before. It's not a 6% deal. Unless you have the underlying conditions, you're very likely to be fine about it. So we got a little far afield on that question, but.
No, it's all right. No, that's good. Stasha asks, why is like a dog park open but not a playground, for her daughter? It doesn't really make a lot of sense for some people in that regard.
Yeah, I think it's stupid to have the dog parks open. I mean, the dogs can't transmit, kids can. And the last thing we want to see is a bunch of kids bringing it back to homes. Kids are necessarily super spreaders. They are snot-nosed as it is, including my two. So you necessarily create a greater risk by having the playgrounds open. I think just out of kind of the consent of the government type problems, you couldn't make it clear of an argument. Well, dogs can run around and it is what it is. And I think it probably would have been better just to shut down both. But some jurisdictions made the decision to leave the dog parks open, and it was a little bit silly.
Barry asks, why keep kids locked up when we have data saying kids may carry the virus? It's kind of similar to the other question, but they don't seem to transmit to adults. I guess that goes back to why certain things are open versus other things aren't.
Yeah, that's not true. Kids definitely do transmit to adults. Kids have been seen at kind of a higher rate of having the diarrhea type cases. So if you're familiar with the virus, it attaches to what's called the ACE2 receptor. The ACE2 receptor is certainly prevalent in the lungs, in the kidneys, in the liver, and in the lower GI tract. So kids are seeing more distress in the lower GI tract, diarrhea, the rest of that. As anyone knows that has had a kid with something like that, they're, because of unwashed hands or poorly washed hands, they're pretty good at spreading it. So, and there's been a number of good studies in the UK about that. So that's where they first started to notice that the kids are expressing it differently. And just because of the nature of that type of expression, as anyone knows, that can be pretty fruitful. That can, not like sneezing or whatever, a kid with diarrhea can do a great job of spreading virus. So, that is something that we're starting to get wise to, and certainly something that we want to avoid.
Interesting. Okay. Another question we have is from Mary, from Leslie Landsberg. I will ask again. She asks, what point will the Texas government offices reopen?
Oh, okay, yeah. We already have a plan in Dallas County to open up a number of our services along with the governor. Governor's opening stuff up, or we're starting to open stuff up. Not all the tax offices will be open, but some of them are going to start to open. We're going to open, of course, the district clerks have stayed open. The county clerks have been open, particularly, the criminal county and district clerks. Those offices are slated to open here in mid-May. We have, as I mentioned before, we have some major, we have a good enough amount of PPE to get us to June. So we're okay in that regard. We are having the worst time getting the Lysol that we need. So, we will take, Lysol wipes, the Clorox wipes. We're trying to find a way to get the sanitizing of our public areas. Because, as many of you are familiar, we have gigantic public areas with tons of seating and tons of things to touch and a lot of restrooms. I mean, we serve a lot of people in a lot of these buildings. So at least for the Dallas County part, and when you talk about jury rooms and the rest of that, there's still a lot of sanitation stuff that we need. So we're going to end up doing that in a very staged fashion. So jury services aren't just going to open. The Texas Supreme Court's been clear about that, because every county is dealing with a lot of those same problems. We're going to need a lot. And this is not like this is gallons and gallons of sanitation stuff. I mean, our janitorial contracts, we don't do that in-house. We bid that out. Those are millions of dollars. I mean, for each of these buildings. There's just a lot to clean. So that gives you a little bit of idea of the scope of just how much there has to clean and how much, stuff we need. So we'll probably be working, because of that problem, at 50% capacity for most of these offices, probably well into July. It's just going to take a while to obtain a lot of the chemicals and just stuff that we need.
Gotcha. Thank you for that. Chelsea Williams asks, and I guess put your constitutional hat on for a moment. Do you think that the framers intended for constitutional rights to be suspended during the pandemic?
Yeah, and that's of course been an interesting one. One that so if anyone knows me knows that I'm a big Justice Scalia fan. Got a chance before he passed away. And there's been a number of interesting, well, it's my right. Well, let's be very careful about what your rights are, right? Because you have penumbral rights that were kind of made up by the Warren Court in the past. And that's what led us to, the right to abortion. It's what led us to, a lot of things that we find repugnant as conservatives. Your right to operate a business is limited. Now, you don't want to go back to Wicker versus Fillmore. I mean, where essentially you got the FDR administration stopping a guy from growing corn when he wasn't, sending it anywhere else. That's problematic, and that's bad case law, and it's led to a bad line of case law. But regarding, the Constitution's ability to address a crisis situation, I think the framers did intend, and Lincoln did make very clear that there are measures that can be taken that are extraordinary, that are absolutely contrary to the general order of our rule of law nation. But as long as they are measured in time and scope, they are lawful. And we've seen examples of that in the past. And unfortunately, many of them do have to do with FDR. They were given that blessing. And, for many conservatives, that is something that is uncomfortable. But from a practical standpoint regarding the case law that is there and the reason why, I'm willing for it to be chipped away a little bit, but the body of it is good. If conservative leaders are unable to address crises, we guarantee liberal fascist tyrants to succeed us. And we have seen that over and over again, both in the United States and in other places. You look at Argentina, you look at places where, you have a classical liberal government, a little bit of hemming and hawing, disaster happens, they don't respond appropriately, and then, military dictator or strongman comes in. And that is, that we've seen that story play out throughout the entirety of the world. I mean, when you can't get the job done, when the bad thing happens, you get your butt booted out. And unfortunately, the strongman comes in. He'll guarantee that he'll, be able to take care of the temporary problem. But unfortunately, he's going to extend those restrictions just for the temporary problem to every other aspect of life. And, so what you need is a good, honest conservative that will expand the powers of government when necessary and recede immediately. And I think that we're seeing that here in Texas. I think the governor has done a good job of saying, listen, we had to do the strong action. So, and if you look at the success of Texas versus other states, and particularly other states that have the same amount of geographic separation that we have. I mean, we're not New York, we're not New Jersey. Okay, so that's not necessarily a fair comparison regarding how things would work here. So to say, oh, we weren't New York, we were New Jersey, we were never going to be New York, we were never going to be New Jersey, but we could have been some other states. We could have been a lot like Georgia. You look at some of the numbers, the per capita numbers in other places. We did an excellent job of arresting the spread of the virus early, and we are giving ourselves a much better opportunity to go forward. And the governor has, in a very smart way, given up those extraordinary powers. He's made sure to step back. And if we as conservatives can act like that in every instance, take charge, do the right thing, make sure that you're, buttoned up regarding all the constitutional pieces of it, and then immediately recede once the threat is gone. I mean, I think that's what we must be able to do over and over again as conservatives, or we'll open the door for that tyrant to step in. And listen, Judge Jenkins has done that. He has been that type of guy that, it's just the liberal, I'm your daddy, I'll take care of everything for you. Listen to my howdy doody goofy ass voice and trust me. Well, I don't, and you don't either. So we don't need any more of that. We need someone that can just, good, cut and dry. This is what we got to do. This is the mission. Now the mission's over. Back to life.
Strong words. Tell us how you really feel, right? Ophir asks, with tongue firmly in cheek, all right, this is interesting. Have any of your Democrat colleagues complained that statistics are only being reported for men and women and not any of the other 56 genders?
Yeah, I'm guessing that's got to be problematic for, it's funny too, because you could see the transgender rights campaigner, yelling and screaming that, that particular individual was not properly identified in death. How about we worry about the fact that they've since passed on and not, whatever fuzzy gender thing they want it to be. Anyway, yeah, we've certainly seen silly season in a number of folks. I mean, both liberal and conservative. But I have been impressed with Commissioner Price. He and I, kind of see eye to eye on a lot of these things. Just get the damn thing right. Make sure that you're not crushing people. Make sure that you're saving as many people as you can, and just do what's right. Just do what's right on a daily basis. I know that sometimes that's difficult to think that John Wiley Price thinks like that. But listen, everyone in their own world, they think they wear the white hat. So for all the things that he's done in the past, I'm sure he thinks that somehow they're justified, and it is what it is. I'm never going to argue with him about that because, that's the past. But, looking forward, he's trying to do what's right for a bunch of poor people. That's who he represents. He represents a bunch of poor people that are, very vulnerable. And, he's got his head on a swivel, and he's really clear about the fact that this could be very painful to his folks. But what's more painful right now is the fact that, you can tell folks that, oh, well, the eviction's not going to happen this month. Yeah, but it's going to happen 3 months from now. And I'm already out of a job now. And getting a job in the middle of what will end up being an economic depression is, a hell of a thing. So, he's certainly very, very keen to the fact that we've got to get some of this economic stuff going very quickly, or else there's going to be a lot more death and destruction than would have originally taken place from the virus should we allow this to go on too long regarding shelter in place.
Gotcha. A couple more questions before we go, if you don't mind. I promise everyone I get to all their questions. What loan programs statewide or in the city, they ask, are available? Other financial aid programs are available to the residents of Dallas County and also for businesses?
And I pulled up that huge list. So let me first start with what is kind of new and coming down. So the federal government transferred to Dallas County about $214 million. Some of that's going to be spent on, some of our COVID-19 needs, but other it's going to be, direct disbursements, if you will, to the people to fix things. So one program that's coming up, there will be some rental assistance that's going to come up. That'll be $1,500 per month per person for a 3-month period. It'll be administrated in the early phases through Jewish Family Services, Friendship West, and Catholic Diocese. They have rent programs that the city and the county send people to, so they're already stood up, if you will. And not unlike during the Bush era when we started to allow these nonprofits to handle some of these programs like this, they're not taking any off the top; they're just distributing the money. So we have some nonprofits in place to help start distributing that money once we approve that next court. There will be a robust small business program. Those loans will start off on those loans. Those will actually be grants at $3,000 a piece. Businesses under 100 employees. Because there's so many people that miss the SBA loans, we're making sure to get some of our federal dollars out to our small businesses to protect them. And quick little plug here. I need you all fighting hard to make sure that Judge Jenkins does not get away with hiring his 3 political cronies. What's his face? Miguel Solis, Philip High, and Patricia Nava for $76,000 a piece. They've done the majority of their work. I asked for the work that they've done. They're trying to essentially do 3 months worth of work for $76,000. It's not going to happen. Hopefully, keep putting pressure, particularly on Dr. Daniel. She's probably the one that'll come over and put the kibosh on this. Price and I are pretty clear that we hate this. That's $76,000. $200,000 some odd dollars a piece. I mean, those are CARES Act funds that we could be using to, $3,000 a piece per month for some of these small businesses. I mean, that can be life or death for a couple of restaurants, a couple of places that we either see or don't see when it comes to December. And I'm going to be, I am hell bent for leather on this one. I want that $3,000 in the hands of that business, and I want to show up at Christmas, Hanukkah time, and see that business open. I don't want to see Miguel Solis with a new, Lamborghini or whatever he needs. He doesn't have kids. He can just buy a bunch of shit. Anyway, so. But
Interesting.
there,
Yeah.
there, there are also more of those types of programs. If you go to dallascounty.org, we have a tremendous amount of partners in the, here we go. So we've got.
Is that the best place for people to go to find current resources available?
Yeah. So, for abuse, we have childhelp.org. The food for both, donating and getting people that need food. Brother Bill's Helping Hand, Catholic Charities Dallas, City Square Food Pantry, Cristo Rey College Prep, Crossroads Community Services Pantry, Interfaith Family Services, Jane Pruitt Community Pantry, Meals on Wheels, Minnie's Food Pantry, everyone knows North Texas Food Bank, Pleasant Grove Food Pantry, Vickery Meadow Food Pantry, and Closed Closet. Those are the big.
Jewish Family Service you also mentioned, right?
Yes, they're also heavily involved in this point as well. Those lists are and tons of other resources, rental assistance and other programs that are there are on dallascounty.org under the COVID-19. We have a crummy website, but at least we have those things listed to get people started. And just to kind of let folks know, this has been outstandingly difficult regarding the coordination of getting people to resources, because you can only imagine we have a ton of people in Dallas County that are working poor or working class that have never reached out to resources, right? Poor people generally know where to go to the food bank, times of free clinics and stuff like that. We have a very significant amount of people, particularly Hispanic, some Spanish speaking here in Dallas County, that have never had to reach out for resources. They've always been swinging hammer or doing what they've got to do to take care of their families, and been very prideful in being able to do that. And now they're laid out, and now they really need that help. So it has been a tremendous coordination effort to get folks to those services, and it's been difficult. So it's one of those things that I don't think a lot of people have seen or appreciated. And I'm not trying to pat ourselves on the back, but it was something that was very disturbing to see how much decimation and how many people that have never asked for a handout in their life desperately needing something.
Gotcha. Yeah, that's very important. A couple other just quick questions here, I guess, rapid fire here. How can we help defeat the 3 hires? I guess if there's a couple of tips or things that you're asking us to do on that. And then also, someone asked, why are we housing the homeless population at the convention center? I'm not sure if you can speak to that or not.
Yeah, they're not at the convention center. They're in hotels. And they're at the homeless at convention centers was, that was another crisis. They're at some area hotels. One up in Addison. I'm sorry, one in Farmers Branch, and somewhere else. I mean, basically, we've had a number of shelters. We had one shelter where they had 13 positives on one day, and essentially everyone was assumed to have been exposed or positive. The testing since has shown that like 50% were positive. So, there's these hotels that are empty, that are dying. So they go and get, rooms at some of these hotels that are giving us rooms for cheap. That is not Dallas County money. That is federal money that's being spent on that in those essentially quarantine situations.
What can we personally do in your opinion to defeat those 3 hires of Clay Jenkins?
Work on Dr. Daniels. She's probably the 3rd vote that's going to be required to make that happen, but also raise the temperature. I have heard of no fewer than 7 people who have reached out and wrote a letter to the editor, to the Dallas Morning News, and they have refused to publish on that. Keep pushing them. Keep pushing the Dallas Morning News on Facebook, on social media. Why aren't you talking about it? Why haven't you done anything about this? I talked to Jack Fink, a couple folks at CBS, and many of the stations just aren't interested in running it. Miguel Solis is a golden boy for a lot of people. And he essentially raised $600,000 from, ostensibly 1 or 2 donors immediately. And those same kind of powerful people are doing their best to protect him. And it's bullshit. I mean, you don't throw the ball to someone like that in a time like this, or at any time. I mean, you get the best people to do the best work for the taxpayers' dollars. And this stuff just drives me up the wall. And, that's when you see me get most mad at Commissioner's Court.
Yeah, I can imagine. Anything on property taxes being done as part of this relief?
The judge and others have been trying to work out payment plans. The problem is that tax collection, one, isn't a separate sovereign. So we have the tax assessor collector that does that. And John Ames has not, I mean, he's willing to do something, but the problem is he really is bottled up by legislation. So it's going to be important for, if we have a special session, to do something regarding, because not all entities need all of their money at the beginning of the year. It would be great if we could allow more folks to pay out, pay sums quarterly. That's not an option that we have under the current legislation. If we could get that, we could help a lot of people relieve some of that pressure, particularly in that first quarter. Because I mean, I think if we can get to a vaccine next spring, and if we can get to a number of these successful drugs, particularly in the lead up to the fall, we're going to be back riding high again by the end of the year. Into that, once we get to January, February, March of next year, we should be in a much better place than we are now. So that overall tax problem, that why tons of people will not be able to afford their property taxes come January unless we start to see some type of uptick. That's one of the reasons why we get the economy going. But there's going to be plenty of folks that are still hurting and need some of these payment plans. That's the best thing I can do, or that's one thing that's being worked on. The one thing that's hugely unfortunate, I'm one vote on a 5-member court, is those sons of bitches are going to want to raise taxes. They just are. With the tornado, it freed the cap. So any disaster declaration, you don't have that 3% cap. So, the revenues that we've lost, those folks are really thinking about going to a full on 8% tax hike, which is the worst. I'm going to fight for the effective rate. That's the right thing to do. We're going to necessarily have to fire a lot of folks in Dallas County. It is not just a hiring freeze. We are going to have to lay off a ton of people in Dallas County to do what we need to do to be right by the taxpayer.
Gotcha. Yeah, and Lane Sullivan makes a good point. Definitely covering the Jenkins, really his cronyism and that whole story with him. Definitely, I encourage all the DJC members and anyone that's watching to post on the commissioner's Facebook sites our concern. I like that point, Lane, so I appreciate that.
Thank you, Lane. Thank you.
Yeah. And then, in your opinion, when do you think we'll reach the phase 2? Do you think it will actually be the same timeline that the Governor Abbott laid out, or do you think that it's going to be earlier, later?
I think it'll be on time. I mean, I think necessarily because of, that kind of the false start, if you will. There's going to be a vast swath of businesses that don't open up under 25% because it just doesn't make sense to the margins, right? Some of the folks that are playing fast and loose may do that, which is somewhat troubling, right? Because they'll open up, not abide by 25%, they'll let it go. And they may also have some problems regarding keeping things cleanly because they're not afraid of bankruptcy. That's probably what they're heading, just grab some cash and walk away from it. That could be troubling. I don't think that's going to be, so widespread. So I really think that this next 2 weeks of May are going to be very manageable. There's going to be some things open. Most of the folks that are going to be opening have a little bit of deeper pockets. They're going to be, just trying to angling for a better day when it comes to that May 18th. So I think it's going to be reasonable because of that. It's really not going to be widespread. I think there's still enough people that are afraid that, things are going to be pretty well contained. But you know what? I can be wrong. And we could see a huge spike and it could be a huge pain.
Gotcha. Well, thank you so much, JJ. I appreciate you going extra time here, extra innings to get us through all these questions, and hope everyone.
There was a lot of questions. Just to let everyone know, I clearly have not gotten a haircut.
Me either.
Pretty ratty. But it is what it is.
Well, yeah, no, I appreciate the time. And if anyone has any other questions for JJ, where can they reach out to you, JJ? What's the best place to reach you?
Sure. You can email me, jj.koch@dallascounty.org. I get a good 100 emails a day from constituents, and I try my best to get back within that same day or within a couple hours. There is a couple other things that I got to get done during the day. So please forgive me if I can't return the email very quickly, but I've not missed one yet. I mean, there's no just sitting out there that I haven't gotten back to, so I'll get to it.
Perfect. And I'll also post your Facebook page link as well. People can reach out to you there. And if there's any other questions that come up afterwards, please feel free to reach out to myself or post on the page, and I'll forward them over to JJ. I'm sure he doesn't have anything else to do.
It's okay to work long days. I mean, I'm happy to be working for folks right now because I know there's not a lot of folks working. So, better I can do, the better for everyone else, right?
Absolutely. We're all in it together, as I say. So absolutely appreciate it. Appreciate it, JJ. And for everyone else, we have some interesting and really unique events that we're planning up in the next coming weeks. Some more details will be shared with everybody here shortly. Working on a couple of the big names. I will announce those very soon. I don't have dates yet, so I can't quite put out a official date, but I will definitely keep all of our members informed. So be on the lookout for that as we continue these virtual events and some exciting news coming out for in-person finally, hopefully sooner than later. And as we launch the next phase of Dallas Jewish Conservatives. So I know it's a little bit of a tease, but stay tuned, and we appreciate, of course, everyone joining us and all of your support. And I will talk to you all online or over the phone. You know where to find me. Thanks so much. Have a great night. Take care. Bye-bye.